side of each lower leg as shown, and place a strap distal to the knees from one side of the board across both blanket rolls and legs to the other side of the board. As previously mentioned, adding a commercial head immobilizer or blanket rolls against the OSS head flaps is highly recommended to increase the fixation of the head, preventing any inadvertent movement from the sudden road or landing shocks which occur when transporting the patient by road or air. If blanket rolls are to be used, slide the board up so that the head extends beyond the cot enough to allow you to wind adhesive tape around the blankets, patient's forehead in the OSS headpiece, and the board easily. Then place it back properly on the cot. Extend the patient's arms with the palms facing in along each side of the body, and secure the arms with a separate strap that goes from one side of the board to the other, across each wrist and the upper legs. Using a strap which is a different color from the others that have been used to secure the patient to the long board is helpful, as it helps identify this strap to release it once en route, so that the arms can be freed to start IVs and recheck the blood pressure. Recheck the patient's motor, sensory, and circulatory status in all four extremities, and secure the packaged patient and longboard to the ambulance cot. Move the cot straps so that they do not lie directly over the straps that are used to immobilize the patient to the longboard. Once the cot straps have been applied, you are ready to load the patient into the ambulance. How well any extrication vest affixes to the torso is key to how well we can immobilize and protect the spine, since, once the head has been secured to it, any movement of the vest up or down or laterally on the torso will cause movement of the head, resulting in compression, distraction, or angulation of the cervical spine. Because the affixation of the OSS to the torso is provided by tight straps which completely surround areas where large bone structures lie near the outer surface of the body, the shoulder girdle at the upper torso and pelvic girdle at the lower torso, it secures to the torso more tightly and more effectively than vests which rely on simply straps surrounding the torso and upper legs. You can see that with the straps properly tight around the shoulder and pelvis, the subject's breathing remains unaffected and the vest remains unmovingly immobilized to the torso. Because some limited movement of the scalp on the cranium remains regardless of the external pressure placed against the sides of the head or tightness of the straps surrounding it, external devices cannot completely immobilize the head, and some slight rotary movement remains possible with any pre-hospital immobilization device. We have found that to successfully purchase the head flaps must extend forward along the lateral sides beyond the outer ear, so that more than half of the circumference of the head is boxed before the straps are added. The longer head flaps on the OSS produce this even in patients with an extremely large head or large void between the back of the head and the device. The unslatted, padded anterior ends of these flaps allow them to conform around the natural curve of the head, providing a better grasp. We have not found a presently available extrication vest which provides better immobilization of the head. After seeing the simple steps that are followed when customarily applying the Oregon Spine Splint 2, seeing a number of variations which may be required and have been anticipated in the design of the vest will extend your capability and skill in using the device. Should the patient's injuries include a fractured clavicle, an alternate method to the X, usually used to anchor at the upper torso, has been provided to avoid any straps or buckles from lying over the mid-clavicular area. Anticipating this, the orange and green strap halves located on each side of the vest have opposing male and female buckle halves. Lay the left upper orange strap half across the left shoulder and pass the left lower green strap half through the left armpit. Connect the buckle halves found on both to each other, forming a loop around the left shoulder, and pull them snug. The loop will be a straight vertical line from the top of the shoulder down to the armpit, just medial to the anterior axillary line. To make a similar loop on the other side, pass the right upper green strap half over the right shoulder and the lower right orange strap half through the right armpit. Connect their buckle halves and pull them snug, forming a loop similarly located around the right shoulder. Tighten each loop by alternately pulling on the ends of the two halves forming it, so that the buckle ends laying over the anterior aspect of the shoulder and is neither over the top of the shoulder nor partly intruding into the armpit. When both have been sufficiently tightened, the vest will be immobilized to the top of the torso by this pair of loops without any straps or buckles crossing the anterior protruding clavicle, and both shoulders will be held slightly drawn back. As well as its customary application to a sitting patient to immobilize him while he is removed from the vehicle to a supine position on a longboard, the Oregon spine splint can also be used to maintain the inline immobilization of the head, neck, and torso in a number of special situations where the patient is found in a lying position and placing him on a longboard is impossible or impractical. This may be necessitated by the confined space in which the patient is found, or need to allow continued articulation of the hips and legs to effect egress from a collapsed structure, machinery, or small cave, or in tactical situations where the shield behind which the patient and rescuers are protected is of limited height. To place a supine patient in the Oregon spine splint, release the white Velcro tab which keeps the back folded, both long groin straps, and the three black tabs which keep the torso side flaps formed into a pouch holding the remaining straps, so that all of the torso straps are free and available at the sides of the vest. Place the device flat on the ground beyond the patient's head. Adjust the position of the device so its center is in line with the midline of the patient and its bottom edge is adjacent to the top of the patient's head. While the manual immobilization of the head is maintained without interruption, an EMT at each side places a hand in the patient's armpits and, in controlled short increments, drags the patient along the body's long axis up onto the vest. The EMTs should alternately slide the patient, then relocate themselves as needed. Never move the patient and your location on the ground at the same time, as this will result in undesirably uncontrolled movement being reflected onto the patient. Once the patient has been moved so the top of his head is approximately aligned with the top edge of the OSS, stop. Then secure the OSS to the patient as has been previously demonstrated. Once the patient has been fully immobilized in the OSS, the patient can be dragged longitudinally onto a longboard or a sked, and fully immobilized to it in the prescribed manner before moving him further or initiating transport. After each use, the OSS should be inspected and sanitized following the recommended procedure. Once this has been completed, the unit should be repacked so it will be ready for use when needed next. The OSS has been designed so it can be repacked easily and quickly. Start by laying the vest on a flat surface with the strap side facing up and the straps extended. Slide each of the adjustable buckles on the black groin and other torso straps back to the ends, leaving an inch or two of each strap end available to facilitate tightening when next used. Lift the bottom end of the vest until upright and continue to turn the vest over so the groin loops lie flat along the inside of the vest, over its top edge, and partly down the back. Secure the Velcro tip of each against the Velcro rectangle on the back side of the vest. Once the groin straps have been secured, fold the middle section of the vest, placing its two long halves against each other, and secure them together by fastening the white Velcro tab around their edge. Now lay the folded vest back down as shown. Gather each strap and fold it so it lies against the raised center section. There is no exact position necessary, but the straps on each side should be neatly gathered and laid on the side flap so that the buckles do not lie on top of each other. When all of the straps have been folded and placed on the side flaps against the raised center section, fold both flaps up so the straps are gathered in the pouches that are formed.